Hello, in this presentation I will be talking about my health family tree and how my family health history has influenced my understanding of my own health risk. By examining the health conditions, behaviors, and experiences of different generations in my family, I can better understand patterns that may affect my health in the future. I will also talk about how these patterns have shaped my perspective on prevention and importance of maintaining healthy habits. So get to know my family. My family consists of my little sister, my little brother, me, and my parents. This is a recent picture we took on our trip to Colorado for Christmas. There was no snow. Climate change is real. Welcome to our family. So my family is originally from Guatemala. My dad came to the United States back in 2001, 2002, and then my mom and I came back in 2008 when I was 8 years old. I did get sick a lot. My early childhood, I spent it a lot in the hospitals. Unfortunately, back then, especially hospitals in Guatemala, either was too far for we were, or they were not the best. So we did have to go to El Salvador. Thankfully, we lived close to the border of El Salvador, so crossing the border, getting to the border was just a few minute drive, but it was still a process of getting the paperwork done and then being able to go to El Salvador. And they did not care that it was a medical emergency. My mommy still had to fill out all the paperwork and check everything before being able to cross. That's one of the reasons we did come to the United States, because of the healthcare. And then ever since then, I haven't gotten sick. Must have been something in the air. But because of this, much of my family health history reflects on limited access to healthcare that many of them experience. Many of relatives did not receive regular medical care or preventative treatment. When looking at my family health tree, I organized it in 3 generations: my grandparents, my parents, and uncles and aunts, my siblings, and me. Examining these generations helped me identify patterns in both physical and mental health conditions that appear throughout my family. So we're gonna start first on my mom's side, and we're gonna talk about the first generations, which is my grandparents. This is my grandma and my grandpa. Looking at my grandparents' generation, several serious health issues appear. On my mom's side, my grandma had type 1 diabetes and experienced getting both of her legs removed, and then before passing away at the age of 79. She did put up a really good fight. She did pass away back in 2022. My grandpa, I did not get the chance to meet him. He did meet me. My mom tells me he met me, but I didn't remember. I was a baby. But he did pass away, and he did struggle with alcoholism and later died from a stroke at the age of 61. Now we're going to talk about on my dad's side, my grandma and my grandpa. On my father's side, my grandmother suffered from lung problems and passed away at the age of 30. She did not struggle as much. She didn't go to the doctor regularly because she wouldn't get sick or like too sick to get like rushed to the hospital until towards the end, when she did start feeling really bad. And when she was taken to the hospital in El Salvador, they asked her if she has been a smoker, and she said she had never smoked in her life. But unfortunately, they had found a lot of smoke in her lungs, and it turns out that her kitchen did not have the proper vent. So cooking with actual wood was the reason why she has so much smoke in her lungs. And she passed away in 2023. And then my grandpa, has experience with high blood pressure and has also struggled with alcoholism, but he got sober a couple years ago, a long time ago. But he did, get this, he has had 5 strokes in his life, and he is still alive at the age of 75. What a blessing. You know what he says? 1 boiled egg every morning. That's one of the things he does. And then he eats a bunch of other things that's just like, but that's one thing, you know. He did take care of himself when it came to eating healthy, and then like all these recipes that, you know, his father passed to him and all that. The only thing was the alcohol. But other than that, he's still alive at the age of 75. Looking at my grandparents shows a pattern of cardiovascular problems, substance use that has appeared, that we see in multiple of my family members. Second generation is my parents, it's my mom and my dad. In my parents' generation, I noticed several health concerns. My mother is 45 years old and did experience postpartum depression after giving birth in 2013. And she was diagnosed with, she was on the verge of getting depression. And then she has also dealt with anxiety, high cholesterol, and prediabetes. My father, age 49, was recently, like 2 weeks ago, diagnosed with arthritis on his left shoulder due to his work consists of heavy lifting. But in the past, he did struggle with alcohol use and smoking. But he made the decision of getting sober when my little sister was born. That was 15 years ago. And he's been sober ever since. He started smoking and drinking at the age of 12. And then he stopped 15 years ago. It has not gone back. Yes. Now we're gonna go talk about the second generation, which includes my uncle and my aunt. We're gonna talk about on my mom's side of the family. So on my mom's side, I have 3 aunts, ages 55, 59, and 63. All of them have struggled with high blood pressure and high cholesterol. Then on my uncles, I did have a total of several of my uncles struggle with alcoholism, and one of them passed away. They were a stillborn. The other one was killed at the age of 25. He was a soldier back in Guatemala. And another one was killed in a bar fight at the age of 40. On my father's side, I have 2 uncles and 1 aunt currently alive. My older uncle, age 51, he does suffer from heart problems and gets frequent seizures. Sorry. And my aunt and my uncle are both healthy, as we know as of right now. On my dad's side, he did have 4 brothers that were either stillborn, the other ones died a couple months, or another one died. 2 of them died at the age of 1, and it was because of the same. Getting to the hospital was not an easy task back then, and then that was something I did not know until asking my dad about his side. He's like, yeah, before me there was a brother, he passed away. I'm like, huh. And he's like, before your other uncle there was another brother, and between your aunt there was another brother, but he passed away. And I'm like, huh, interesting. And it's all because the hospitals were not, especially back then. Well, today it's still, if you don't have the money up front, they will not even look at you, and they will ask for it in a big, amount. Like it's gonna be this much. Not like here, like sometimes the visit is not that much. Back over there, you're talking about hundreds, and it's not easy getting that money. So, that's also one of the reasons why we will always go to El Salvador. It was a little bit cheaper, and they were a little bit, okay, we will take care of them, but figure out how you're gonna get the money before, we get the test done, stuff like that. But at least they will take them into the room and get them checked out, right? And then in Guatemala, they wouldn't even look at you. Like before asking them your name, they will say it's gonna be this amount. Yeah. Okay, and then my generation includes my little sister, my little brother, and me. In my generation, there are fewer serious health conditions so far, but there are still some experiences worth noting. My younger brother, who is now 12, experienced seizures between the ages of 1 and 2, but they stopped by the time he turns 3. And has not had one ever since. My sister, age 15, had a heartburner when she was 5 years old and was diagnosed with anxiety at the age of 14. And she currently attends therapy, which has been helping her a lot to manage her anxiety and how to, approach everyday life and activities. As for myself, I'm currently healthy compared when I was younger, but learning about my family health history has made me more aware of potential risk and the importance of prevention. So now we're going to talk about health patterns and risk factors. After examining my family health tree, several patterns became clear, like cardiovascular conditions such as stroke, high blood pressure, and high cholesterol appears very frequent in my family histories. Diabetes is also present, especially on my mom's side of the family. Another pattern that appears in multiple relatives is alcohol use, particularly among older generations. Mental health is another important factor, including anxiety, postpartum depression. In health psychology, we learned that both genetics and environment play a role in health concerns. While genetics may increase risk for certain conditions, lifestyle choices such as diet, exercise, stress management, and avoiding harmful substances can significantly reduce these risks. Especially since my dad was able to have so much will and become sober after starting to smoke and drink at the age of 12, like I mentioned. And my grandpa on my dad's side being, eating a boiled egg every morning, every day. Yes. Positive changes in my family. One positive change in my family is how my mother has taken her mental health seriously. Ever since she was diagnosed with postpartum depression back in 2013, and then she was at the verge of depression back in 22 after my grandma died. She sought professional help and attended therapy for over a year. Her therapist recommended exercise as a way to manage stress, and she now regularly practices Pilates. And goes on walks after dinner. Every time after dinner, every single day, we go for at least 30-minute walk. Or whenever she feels stressed or overwhelmed, she loves to go on walks. These habits have helped improve both her mental and physical health. Seeing her prioritize her health has also influenced the way I think about self-care and prevention. I also, I go with her on after dinner walks. Whenever I do feel stressed or like, I do go on a little walks. And I talk to myself. I really, well, not by myself, but no, yeah, I talk to myself. But it helps me a lot. I also do try to work at least 3 times a week. It's especially whenever I'm so busy, twice a week. It's okay. personal health plan, sorry. Based on my family health history, I want to take preventative steps to maintain my health. This includes staying physical active throughout regular exercise, maintaining a balanced diet, and attending routine medical checkups. Because conditions such as high blood pressure, diabetes, and high cholesterol appears in my family, monitoring these factors will be important as I get older. I also plan to prioritize my mental health, which I already do, by managing stress and seeking support when needed. By developing healthy habits, now I can reduce the risk of developing some of the health conditions seen in previous generations. And then this is my little tree. I put my grandparents, my parents, and then my parents, my uncles and aunts, and then my siblings and I. In conclusion, creating my health family tree helped me better understand how genetics, lifestyle, and environment influence health. It also showed me how access to healthcare and health behaviors can significantly impact long-term well-being, especially comparing all my families are still in Guatemala and my parents and I here. While my family history includes several health challenges, it has also motivated me to take preventative steps and prioritize both my physical and mental health. Understanding these patterns gives me the opportunity to make healthier choices and potentially reduce my risk of future health problems. Thank you.